All right. I can't read that way. Clinical Psychopharmacology for the Busy Practitioner by Hugo Rosen. Rosen, whatever. All right, so what do we got in here? Wow. So if you want to know all about drugs, psychiatric assessment, antidepressant drugs, mood stabilizing drugs, uh, a lot. Ooh, wee. The violent patient, the suicidal patient, geriatrics, psychopharmacological, medical diseases that mink psychiatric disorders, treatment of drug abuse, alcoholism, psychoactive drug interactions, anti-anxiety and hypnotic drugs, anti-psychotic or neuroleptic drugs. Man, this got a whole. I mean, this is literally like it says. This is the psycho-pharmacologically for the busy practitioner. So it got it all right down for you. So let's go to what does he talk about? So antidepressant drugs, right? In today's world, like a lot of people, especially in America, everybody, I think it was some ridiculous as like 50% of America's on some type of pill, right? One of these drugs, right? Well, this is the categories, but this is just ridiculous. I mean, it really goes into this. Yeah, I'm just reading, and man, it's really going through in detail. Drugs that block alderlene, I don't know how to pronounce half this stuff. Basic heptactic ethanol metabolism, levels like alcohol levels in non-tolerant drinkers, science of alcohol or drug abuse. We got drugs and medical in illness that may induce depression in the old elderly patient. The most common psychiatric symptoms of endocrine diseases, opiate withdrawals, important neuropeptides. After I'll probably still never be able to pronounce these words, but I'll be able to give you a better explanation of what they are, right? So let's go to anti-psychotic. I'm more interested in that than mood stabilizers or antidepressants. 103. Antipsychotic. In 1952, demonstrated the efficiency of chlorpromazine in acute psychosis. At present, there are several antipsychotic drugs, AP, available in the United States. What does this AP stand for? Excuse me. AP, antipsychotic neuroleptic drugs. I don't know if you've ever received that. If you weren't, I apologize. In the United States, they were on all are effective by acting on the nigrosterol system, except Klonopin. Induce pseudo Parkinson. I don't know. It is believed that AP ameliorate schizophrenia by acting on mesolimbic or yeah, wow. You probably can't understand anything that I'm saying either, so I'm not gonna keep badgering these long words, right? You can read the report and then you can pretend that you know what you're talking about. I can see the words and like make sense, but like I've heard of Klonopin. I didn't know that's how you spelled it though. All right. Okay, here we go. All AP have been found to be more effective than a placebo in both acute and chronic schizophrenics. About 75 of schizophrenics respond to AP as compared with only 25 on the placebo. When AP were used in maintenance therapy, one half of schizophrenics relapsed over a 2-year follow up period. However, 85% of the placebo treated patients relapsed over the same period. Therefore, AP are more effective than the placebo, but many patients relapse despite adequate treatment. There are no overall differences in clinical efficiency among the AP drugs. They do differ in their side effects, dosage, and formulations. Okay, wow. And then it goes the frequently prescribed anti-psychotic drugs. Uh, whew, my goodness. Okay, positive and negative symptoms of schizophrenia. I'm not gonna go too much because I'm gonna have to read a lot because this is really brand new. I mean, it's quite interesting once I go through, once I accept the fact I don't know half the words they're talking about, and once it's okay that you don't know the words and you know you just see the word over and over and over again, you know it's important, right? Wow, my, how many bloody things are there? So this is way more intense. You see how I'm steady flipping over here. Side effects of antipsychotic drugs: early onset, variable late onset, other side effects. Yeah, skin rashes, a whole bunch of late onset tardive oh, whoa, rabbit syndrome. What is the rabbit syndrome? Just because, you know, everyone. Rabbit syndrome is a possible late Parkinson variant